Hello, my name is Jessica Gavin. Today is 7/19/2020. I have my notes and back. And this is my lovely assistant, Jen. And today we're going to talk about surface anatomy. So there's 5 important structures that I've identified. One of them are the ears. And this is part of the nervous system. It helps with hearing and balance and those types of things. So anything that passes signals through to the brain is part of the nervous system. We have the mouth, and that's part of the digestive system. So that's going to help with putting food through the mouth, down in the oropharynx, and through the rest of the digestive system. We have the nose, and that's helping with the respiratory system. It aids in breathing, and it helps with filtering out things that go through your nose with the nose hairs and things like that. And we have the eyes, which are also part of the nervous system. They are also a part of the muscular system as well, but for the purposes of this, we'll say they're part of the nervous system because of all of the nerves and everything with the retina have to transmit signals back to the brain. And then we have part of the hands, we have the fingernails, which are here. And those are all part of the integumentary system, and they help with protection of the tips of your fingers. So a lot of this you can relate your surface anatomy back to the landmarks of the internal system. So for example, if I were talking about the deltoid here, you can see the deltoid region, the surface region, and that would be the part of the shoulder that you would be able to find the deltoid muscle. So such as right here, this part of the surface anatomy is on the abdomen. You can palpate the stomach from there. So it helps you to identify those normal anatomy and helps you identify that landmark on the internal structures as well. The clinical application that I've noticed with the nose, for example, is whenever somebody has a situation with enlarged turbinates in their nose, that cartilage on the inside of their nose, it can cause difficulty breathing and congestion. So that's an easy fix. They just do an in-office procedure that shaves those turbinates down so that they can have better airflow through their nose. Another clinical application that I've noticed as well is with the ears. There's a disease called otosclerosis, and that's actually something that I have. It's where the bones of the middle ear, specifically the stapes, have trouble vibrating because they get stuck to the cochlea, and so they have to go in and remove that surgically, or not, they cut it away from the cochlea so that the stapes can then vibrate and send that signal through the rest of the nervous system to the brain. And they can fix it with the surgery, but you can also manage it with hearing aids to help transmit that signal. So that is the surface anatomy, and that's why important.